He's taking a tracheal tube and he's putting it down the trachea so that he'll have a steady flow of oxygen while he's under anesthetics, and also so that Redcliffe will not regurgitate in the airway, and so it's very safe for him to breathe. And in this picture, you can see Redcliffe getting ready for the CAT scan. So you can see all the different nurses and vet technicians that are there at this time. They're helping out with this. And if you see the giant circle kind of in the back, that is the actual machine. And unfortunately, Redcliffe actually did pass away a few weeks after we did do this CAT scan. We actually found a tumor in his adrenal gland upon the necropsy, which is something that would not have shown up on the CAT scan, and it's something that wouldn't have shown up until they actually did the dissection. But none of the other kangaroos had anything similar to it, so it was very unexpected. And the next thing I wanted to talk about was one of my favorite winter visits all year, and that was the elephant exams. I think elephants are some of the most intelligent and entertaining animals that we have in the world of ours. And we did 2 exams on an elephant named Kamba and an elephant named Congo. So in this picture, this is Congo. She is in her early 30s, and you can see Dr. Bonner, he has the ophthalmoscope, and he is performing an eye exam. And I think what's really cool about elephant exams is that these animals are not under anesthesia, like a lot of other animals in the zoo are when they get their exams. Elephants are so smart, and their trainers are so skilled that they manage to teach these elephants how to put their bodies up against the bars, how to take their feet up, move their trunk up, and open their mouth, so that the veterinarian can get to all the different places on the animal to make sure that they're doing okay. And this is actually a video I have, and you can see Dr. Bonner coming up. This is Kamba, and so he's putting his stethoscope on the main thing going down the trunk to get her pulse, and you can see the rod that's right next to Dr. Bonner's head right now. That is part of what the trainers do to get the animal to understand what the vet wants them to do. They put the rod up to where they want the elephant to put their body, and the elephant just knows they have a rod there, they want my head to go there. So it stays right there as long as the rod is there so that Dr. Bonner can get their pulse. And this is another video I have, and you can see that they're giving Kamba the command to open her mouth. So you'll see in a moment she'll pop her trunk up, open her mouth, and bring it up to the bars so that Dr. Bonner can take a look at her mouth and her teeth, and to make sure that she has no styes or tumors going on in her mouth, and to make sure her mouth is healthy. These animals are so intelligent. I can't even believe that we've been able to train an animal that weighs several tons and that has the height of 2 or 3 human beings to be able to get this close to a veterinarian so that they can make sure that they're healthy. And the next supplemental service I want to talk about was a gorilla quarantine exam, and when we vaccinated a lot of face culture. So here you can see me with a 9-year-old gorilla female named Megan. And she came to the Dallas Zoo from the Gladys Park Zoo. And whenever we have an animal come in from a different zoo, we have a certain quarantine period. And this means we have the animal inside of a room inside the veterinary hospital, so they have that time to be away from the animals in the zoo, so that if they do have any kind of contractable disease, it has time so that it won't intermingle with the rest of the population at the zoo. And it also gives us time to monitor them, to make sure they would be a good fit for the populations that we have. And once that quarantine period is over, for gorillas it's about a month, we do a full workup on them. So in here you can see the intubation tube coming out of Megan's mouth. And you can see the technicians in the back there getting blood from her femoral cavity. And so we take the blood, we do a full workup on the blood to make sure they don't have disease in any of their cells, or in any of their red blood cells or white blood cells. And then we also make sure that their heart is okay. We actually brought in an ultrasonographer to do the sonography on the heart to make sure that it's pumping okay. And we did a full workup on her muscles, and we made sure that her arms were good. We really did everything that a doctor does when you get a checkup, plus a lot more, just to make sure that when we mix her in with the rest of the population, that she will be a good fit for our site. And then right here, you can see Dr. Bonner and the rest of the technicians getting her x-rays. This is where they're doing the checks of her bones to make sure that the density is okay, that she's not going to be fractures. And here you can see me with a baby lapid-faced vulture. This vulture is one of many new arrivals at the zoo at this time. This is springtime, so obviously we're having a lot of babies come up. And one of, to me, the most fun jobs that a zoo veterinarian gets to have is being a pediatrician. We have so many new babies popping up all the time, and so veterinarians need to be able to work with prepubescent and to work with very young animals, because they are obviously some of the most susceptible animals to disease, along with geriatric patients. And so it was really cool for me to get to hold him while Dr. Bonner gave him his vaccinations, because the babies have to get vaccines quite a bit to make sure that later on in their life they don't contract diseases native to their species. And now I want to talk a little bit about the independent study part of the program. I talked to you a little bit about the mentorship, but the IS part of ISM is also a very, very cool part of this association. So the original work is one of two major projects that we have throughout the year, and it is the research-based project. So I spent several months researching every single species that we have at the Dallas Zoo, and I did a full profile on every single species. So I said a few fun facts about them. I have their name, their scientific name, which is their taxonomy. I talk about their diet, their native region, their lifespan typically, not in wild and captivity. And I also talked about their IUC and conservation status. So what this means is whenever you see an animal and they're classified as endangered, the IUCN has labeled them as endangered because of the numbers they have in free-ranging populations. And in addition to all of the different biographies of every single species, I also did several pages worth of different disease that animals can contract. So I have every single disease known to zoo veterinarians that these animals can contract in captivity. And so I have the name of the disease, they're all alphabetized and organized by mammals, birds, reptiles, and amphibians. I have severity of the disease, treatment, some of the symptoms, how it's transmitted. And all in all, my original work was about 200 to 300 pages long, which is some of the most research that anyone's done in the program. And it actually played a really big part in my final product. My final product is a website that has cataloged all of my experiences in the ISM program. And not only does it have the part from my original work this year, where it has all the different diseases and biographies of the animals, but it also has part of my final product from last year, where I talk about several of the different procedures that goes on not only in a veterinary clinic, but also in a zoo veterinary hospital. And so I was going to show that to you now. My website is ismzoomed.weebly.com, and if you look at your program, it has it on there, so if you want to go home, y'all can look at it for yourselves. So immediately when you type in the name of the website, it is going to come up to this page. And so it's going to come up to an explanation of Dr. Bonner, and it will have his full biography. And so here, the whole paragraph is all of his different associations that I was talking about earlier. And then here, you can read about the ISM program. And this is from Coach Weislong's website, so if you want to read more about ISM when you go home, you can do that here at this link. And then it goes to animals. So I want you all to look at the animal you have in the upper right-hand corner of your desk. How many of you think you have a carnivore? People will raise their hands, and I will pick one of them, and I will ask them to pick birds, mammals, or reptiles and amphibians. So, Grandma, would you like to see a biography of a mammal, bird, reptile, or amphibian?
Mammal.
Mammal. So we're going to go to the Animals tab, we'll select Mammals, and here is all the different names of the mammals that I did my original work on. So I will also ask you to use the animals in your upper right-hand corner, and I'll pick this time based on native region. So I will ask if they're from Africa, and I'll pick one of those people to pick what the actual name of the species is. So Granddad, do any of these species sound like an animal you would want to look at?
Yeah.
You can't read them?
Goat.
Goat. So you'll click on the name of the species, and it'll bring up this, which is the profile from my original work. So you can see it has the name of the goat, it has a scientific name, and as a profile, where it talks about some of the interesting facts of the animal. It says classifies this guy as an herbivore. Its lifespan has an average of around 15 years in zoos. And you can see the type of animal, this is a tardiodactylate. And the lifespan is actually not classified, the conservation status is not classified because a goat is not something that would be an international wildlife species. but a lot of the other species that are in this website do have that information. And then we would go to the diseases tab, and for this one, let's do birds. And this has the document that I created on my original work. So you can make it full screen, and here you can see acanthomobiasis, which affects birds primarily. And you can see that it's transmitted through soil and water, and it gains entry via skin, lesions, respiratory tract, corneal surfaces, which is the eye. Hematogenous spreads to the central nervous system. It talks about some of the clinical signs of it, cutaneous lesions, which is obviously the breaks in the skin, sinusitis, and then you can see some of the severity of it, where it can be frequently fatal, and then it talks about some specific drugs for treatment. And the last part of it is what's for my final product from last year, which is procedures. So I will again use the animal that's in everyone's upper right-hand corner, and I will probably ask based on lifespan if they have an animal under 20 years. So Dad, do any of these sound like a procedure you would want to read a little bit more into?
Sure, dental.
Dental. So when you pull up the procedure, it has pictures of the procedure. It's good that you chose dental because that's one that's fairly not graphic. So if you look in the upper left-hand corner, you can see all of the black and brown. That is the calculus and the bacterial colonies that are on this dog's teeth. And then I go through the process step by step, and I try and use it in words that are very understandable to the public. And so y'all can learn about all the different procedures that go on when you bring your dogs to the clinic. And you can see that the pictures correspond to some of the different steps. So if you want to see ultrasonic scaling of the teeth, you can see that in the top right-hand corner. And if you want to see them removing rotten or loose teeth, because this is actually something that you do the most of in a dental procedure. People don't realize that teeth are largely cosmetic. You don't really need all of the ones that you actually have. So a lot of dogs, when you bring them in and they have rotten roots, it's a lot easier just to pull the teeth out than to try and save them, because it's really just going to cause like heart disease, and it's going to cause issues with plaque, and removing it's actually a lot healthier for the dog. And if you look in the lower right-hand corner, you can actually see that this dog's teeth are clean, and they're white, and they're much healthier. And also on the procedure page, I have a paragraph kind of summarizing the importance of why you would do this procedure. For dental, it's really important to have dental procedures because dental diseases and bacteria can cause really serious infection, and like I said, it can cause heart disease because of the plaque. And so, by performing dental procedures and cleansing the teeth of the majority of the bacteria, you are really helping prevent illness and disease in your dog. And so that's why this is important. And I believe this procedure page, part of the reason it's so important to be a part of my final product is because it really bridges the gap between small animal veterinary medicine, which is what I studied last year, and zoological medicine, which is what I'm studying this year. Because no matter what kind of animal you have, you're going to need to clean its teeth so it doesn't have heart disease. Animals that are in zoos also have surgeries, just like your animals that you have at home. And I really think it shows that being a veterinarian is about much more than just taking care of small animals. Veterinarians do all different kinds of animals, and they help make sure that all the different animals around the world are really healthy and that they're living safe lives. So to kind of conclude my presentation, I wanted to tell you a little bit about what my future plans are for next year. Next year, I will be attending Texas A&M University, and I will be majoring in biomedical science, which is sort of like the pre-vet or pre-med program that Texas A&M has. And my hope, right now, I'm thinking I either want to become a zoo veterinarian, or I want to become a veterinarian who not only works with small animals, but also with exotic animals, so that I really have a diverse appeal to my veterinary clinic. And at this point, I'll probably take about 10 to 15 minutes of questions and answers, not just about what the ISM program is, but questions about stuff that I have experienced, questions about maybe specific animals. So this will take up the last 10 to 15 minutes of the presentation. So I want to take this time just to thank you all, not just for being here today, but each and every one of you guys here has played a huge part in supporting the students that are in this program. I can't tell you how much we appreciate y'all, and you're a big proponent of why we are all allowed to pursue our dreams and our passions. Thank you. go ahead and stop it.